Today we are going to interview Dr. Georgina Hall, one of the doctors who takes care of me at the John Radcliffe Hospital in Oxford.
That's cool. Did you go to Oxford to do the interview?
Yes, I did, Nivy. I went with my mum there a few days ago.
Were you nervous during the interview?
I was a little bit nervous and had butterflies in my tummy, but Dr. Hall was very nice and she even took me to the lab and showed me leukemia cells through the microscope.
That's amazing. How do the leukemia cells look?
They dye the cells so that the normal cells look white, but the leukemia cells look purple.
Purple? Did you see purple cells when you looked?
Yes, I did see a lot of purple cells.
So did you see someone else's cells?
Yes, Dr. Hall showed me a patient's bone marrow cells who had a week of chemotherapy. The cells before therapy had a lot of purple cells, and after therapy there were far less purple cells.
That means they're getting better.
Yes, it's amazing how just a week of chemo can get rid of so many leukemia cells.
Cool.
Can we listen to the interview now?
I can't wait.
Everyone, this week I'm doing an interview with one of my favourite consultants. Her name is Dr. Hall. She's a consultant paediatric haematologist in John Radcliffe Hospital. Hello, Dr. Hall.
Hello.
Thank you for letting me interview you. Could you please tell us a bit about what inspired you to become an excellent consultant in haematology?
Of course, it's very kind of you to say those nice words about me. I think what inspired me was my patients when I was training and seeing how well they did with the treatment that we gave for leukemia. And looking down the microscope, which we will do later on, is very exciting because then you can see the blood cells that are going around your blood in your body, and I can see your bone marrow as well under a microscope. And I get lots of information from that, and then we can do some other magic tests, and it's all very clever, and it's like another world.
Where did you study?
Where did I study? Well, I started off in London, and I worked at one of the most famous hospitals for blood disorders. It's called the Royal Free in London. I had some very famous professors who I worked with. I was very lucky to work with them. Got both my jobs with them. And after that, I had to do some more training in London. And part of my training, I went to live in Switzerland for a bit, in Geneva, which was lovely. Then I came back, and they decided it would be sensible to do some research, which I did here in Oxford. Okay, and that's where I got to know another very famous professor, Professor Weatherall. He's a Sir now, and learnt about thalassemia. And then I stayed here for a bit. Then I went back down to London, to Hammersmith Hospital and Great Ormond Street. And that's where I specialise in younger people and children.
Thank you. I'd also like to ask, what is leukemia and why did we get it?
I can answer the first part of that question, but I can't answer the second bit. So the first bit, leukemia, comes from the Greek. Leuk is white, and emia is blood, being full of something. So it basically means white blood. So when you take a blood sample of someone with leukemia, and that's because they've got it in their blood, and you spin it down, you see a layer of white, which we call the Buffy code. And leukemia means high white cells. And you're special because you didn't have high white cells in your blood. Why people get it? We can look at the genes, we can look down the microscope, and we can see what's happened to make it happen. But we don't know why it happened.
Thank you. How does it spread in your body?
Well, it's everywhere because your blood is everywhere. So it doesn't spread. It's not like other diseases where people think about a lump somewhere spreading around. It's not like that. It's there in your bone marrow, somewhere it starts, and it spreads around your body in that you see it everywhere. So it's not a classic spread.
Why do we lose our hair during chemo?
Well, that's because we give you different sorts of chemotherapy which make your hair drop out. Because they're trying to kill the nasty cells which are dividing rapidly. They also happen to kill the cells which are making your hair and sometimes your gut cells too. You get better once we stop giving you those drugs. And now you're on other drugs that don't make your hair. You don't lose your hair, do you?
No.
You've got lovely thick hair now.
Why is one of the side effects tummy pain?
Again, because of the lining of the gut is very rapidly turning over, just like the hair cells, and so if you give them the drugs, you wrote a lovely poem about this once. If you give them the drugs, they can make your gut very sore and it all sort of dies off and gets running and you get diarrhea. Or the other drug makes your gut not work properly and you get constipation. So 2 reasons to have a sore tummy.
How do you feel when you have to say the bad news to your patients?
You mean at the beginning?
Yeah.
Well, I think for a lot of parents and sometimes for the children, if they've been unwell, to find out why they're unwell is actually not such bad news because they at last know what it is and you know that you can do something about it. I think for you, you were unwell for quite a long time and no one knew what it was. Once you know what it is, then you can start treating you and get you better.
Can we prevent it in any way?
If we can find out what causes it, we can try. We think it's something to do with children nowadays being very healthy and not being used to certain bugs. And we see leukemia a lot in countries which are richer. But that's not completely true because we still see a lot of leukemia in India, Sri Lanka, South America, all around the world.
Does chemo affect you permanently?
Some chemotherapy can. And we know that the chemotherapy we give you for this protocol that you're on is not going to give you any permanent side effects. Some chemotherapy which is stronger for other patients can cause some long-term effects. We are hoping that you'll go off and have lots of children and do lots of things in your life.
How does the chemo medicines fight off the cancer cells?
Well, I always talk about it being like a gardener and you're trying to kill weeds in the garden. It does it in all sorts of different ways. So say you had a weed in the garden, you could dig it up, you could set it on fire, you could poison it, you could do all sorts of things. So that's what we do to your cells, is we give you different medicines that will kill those cells in different ways. Sometimes they starve them of the things they need to grow, other times they poison them, and other times they suppress their production. All sorts of different ways.
Thank you for doing the interview with me. You're an amazing doctor.
Oh, you're very sweet. Thank you.
Thank you for all the viewers listening to our interview. And my uncle is running the London Marathon to support cancer research. Don't forget to donate. Bye!
Yeah.